Welcome back to the Not Your Mama podcast. We are back from a quick 2-week vacation for the 4th of July. Super, super excited for today's guest. I have been trying to get someone to talk about skincare on the podcast I've been looking for the right person for since I started the podcast, because we're always trying to kind of take things out from the dark. There are a lot of things that happen in pregnancy and postpartum that we just kind of live with and don't talk about. And those of you who listen to the podcast know that often I'm talking about things having to do with the core and the pelvic floor. But skincare is a major thing that comes up around pregnancy and postpartum that, inside of my groups, inside of private spaces, people will be like, what's going on with this? But nobody's, finding the right resources or asking the right people. So I'm very, very excited to have Aimee Bowen on the show today. Welcome, Aimee.
Thank you so much for having me, Kelly.
It is a pleasure to have you. Now, first, can you tell us your pronouns and what emoji you most identify as?
Okay, so I'm going to say for pronouns, since I am a mom also, I would say we and us, because I'm sure, as you know, if you're a parent or a mom, there is no more I. Once you have a child, and that's everything from thinking about yourself typically to, having help raising your child, right? Or just taking care of yourself. There's no more we. That kind of flies out. There's no more I. It's all we and us because you need so much help in your life for everything. So that would be my favorite pronouns. As far as emoji, I'm going to say the one that I identify with the most and that I use the most is the one with the big eyeballs, like the surprise look. I don't know why that is. I don't know if it's because I'm shocked on a daily basis or with my own life, or I'm just I learn something new every day, and I find myself always sending just friends and family that what emoji with the big eyeballs. So
I love it. What makes your life so shocking? What are you learning all the time?
Oh goodness, what don't you learn, right? So you wake up and you start learning and just going through new experiences, whether it's health issues or work, or you're raising your family, everything. Even when your child gets out of the house. My daughter's grown now, so she is 20 years old. That's a whole thing within itself. I'm also a grandmother, which I have a hard time saying live.
How is that?
Wow. So and I'm going to say I'm a Mimi because that's what my granddaughter calls me. That's great. She's 18 months old. And as as anyone that's experienced it, it is amazing. People tell you that it will be amazing. I was not thrilled because my daughter was 18 years old when she got pregnant. So nonetheless, any of us that are parents know that that's a big, what are you doing with your life? And she's my only child. So of course there was a lot of battles with that.
But you get to be a hot Mimi. That's the real highlight here.
There's no rocking chair here. Okay.
For sure. That's awesome. So what was it like watching her go through? I mean, we're going to talk a lot about some of the skincare specific issues, but what was it like watching her go through pregnancy and postpartum? I've never asked my own mom this. I feel like we should all ask our moms this, but what was it like to watch that?
Very interesting, because she's still my baby. So you see your child, and even though they're an adult, you're looking at that that's still your child, right? So I was even in there when she had the baby and through the whole pregnancy, and you don't ever want your child to feel any discomfort or pain. It's the same thing, whether they're 18, 19, 20, probably our parents think about us, we're in our 30s, 40s, and they're like, what? They never want you to experience the, rough things in life. And pregnancy is one of those things that's, it's like that book, What to Expect When You're Expecting. There's nothing to expect, right? We know. Does anything go as planned? I don't know. Some people have it perfect, but not typically. So it was definitely eye-opening because I didn't want her to, experience some things, nausea, everything goes hormonal acne. So I was so happy you asked me to do this little segment on skincare because she's totally going through that right now. Yes. So all of that. And then just watching her give birth as in general was just, wow, because she is my child and she was so young. So that was very humbling experience and wow, what a blessing. So
wow.
To watch it all.
Really, I can't wrap my head around it. I recognize that my daughter is only 15 years younger than your daughter. That's not that far away. I'm oh my God, I can't wrap my head around that.
No, it goes so fast.
That's crazy.
You're literally you're dropping them off at kindergarten and they're like, bye. And then before you know it, they're like, okay, I'm going to school and I'm leaving the house and going to college. And now I'm having my own child. And you're like, what? Wait, when did this happen?
Yeah, totally. So tell
Yeah.
us a little bit about your professional background. You are also an on-air TV personality. You've got like a whole thing going on. So tell us about your what you do kind of like in private practice and then all of that stuff as well.
Yes. So I do work with a private practice. I have over 15 years, almost 20 now, of medical aesthetic background,
Mm-hmm.
and also worked for Florida Hospital Advent Health for years and years. So I just have, in general, a pharmacy background, medical background. And so with that, I had my own, always when I was working for a hospital, I had my own practice on the side with my own clients and patients doing their skincare. So I started off doing that literally when my daughter was born, right? So like 20 years ago, I was doing that, and I had my own private practice, which turned into, doing more of that and less of working for a corporation. So I kind of branched out on my own, more of an entrepreneur mom in that regard. And so I started taking care of people's skin years and years ago and learning that, and went to school, of course, for aesthetics. And that evolved into a friend of mine owned a modeling agency. My daughter had done some small modeling when she was younger. We have Disney in Florida, Orlando, that kind of thing. So we had done some of those things as a family, my husband, my daughter, and I. And then that kind of evolved into, I wasn't a fan of doing script. And I love talking to people and helping them with their skin. And I had gone on a couple sets in St. Petersburg, Florida, and there was a producer. And one time we were filming something and we were talking about a tanning product. And I was just, talking about some ingredients. And I said, as an esthetician, you're not going to use this on your skin. And this tanning product is great because of yada, yada, yada. And he's like, wait, stop. We've got to redo this whole thing. We've got to do a wrap. You can't say that on air. This is going to be televised and you have to be an actual esthetician. I said, I am. So from that point on, he said, you know what, since you're an esthetician, every time I get a skincare brand, can I send you the product, you review it and endorse it if you choose to do that. So from that's where I started going on to commercials with it. And then from that, I went to audition for HSN, which is a home shopping network in St. Petersburg, Florida, and ended up doing an on-air beauty
I
expert.
had no idea HSN was in St. Petersburg.
Yes. Yep. Their studios
Oh
are
my
there.
gosh. A lot of the people who listen, I would say maybe 50-50 people who listen to the podcast are either local Floridians versus national, international. I had no idea they were in. Oh, cool. Okay, cool.
Yeah. So we did that. And now since COVID, we're doing Skyping. So if you get a product on air, then we're able to actually Skype in as a co-host, because I specialize in just beauty, health, wellness. And so that's kind of my forte. So sometimes sorry about that's my pug. This is my daughter's dog that still lives with me, by the way, that you hear barking in the background.
What is the dog's name?
Her name is Sarah.
Oh.
And Sarah is an 18-year-old pug. I got
18?
her. Oh, yes. She's still alive.
Oh my God.
All of my friends joke and they say, wait, you still have your daughter's dog? I'm like, yes, I still have my daughter's dog. So we still have this dog. She is 18 years old and she will be 18 in October. So she's technically 17 and 3/4 right now. Yes.
That's crazy. No worries. Don't worry about it. So you weren't just doing skincare. You've branched out a little bit and spoken on some other topics as well. Tell me about those things.
Yes. So for instance, any health and wellness, Philips Sonicare was one of the brands that I've represented on HSN, and also a couple of doctors that were celebrity dentists that needed wellness products represented if they had a dental product. So anything in the health, wellness, and beauty regime is anything that would improve your health or wellness or beauty and skincare.
So tell me a little bit, because this question, I often, when I have experts on, I'm like, how does someone even know what expert to go to, right? So you're a medical esthetician, and then there's estheticians and there's dermatologists. And I imagine there are probably some of each working within the same practices or doing many of the same things. How does someone know where to go or what credentials to look for?
That's a great question. Absolutely. So there's a big plethora of information. It's like going into a candy store. You kind of get confused with that, right? Where do I go? So dermatologists typically are they're skin related as far as the disease process or disease state a lot of the time, or preventing the disease state in a skin. So that would be a dermatologist. So they don't usually focus on, and a lot of them acne. So they don't usually focus on, let's say, anti-aging or things like that.
Mhm.
They're not doing as many aesthetic procedures in that regard. Whereas when you go to a plastic surgeon's or you go to a medical esthetician, a lot of them focus more on wrinkle prevention. So it would be
Mhm.
microneedling, Botox,
Mm.
injectables, that kind of thing. So that would be where your plastic surgeon said it, as well as doing blepharoplasties, which is like an upper eyelid
Mhm.
revision,
Mhm.
or facelifts. That
Mhm.
was the last practice I worked with. Currently, I'm with a practice and we do health and wellness. We do IV vitamin therapy.
Mm.
We do anything with fitness, wellness, and then we also do injectables. So Botox, fillers, microneedling, all of the above.
So those
So
are definitely topics that I think many of my listeners are like curious about, right?
mhm.
Like
Those
where
are the juicy ones.
yes,
I don't know
exactly.
what.
Like when do you start with inject? So I'm going to ask you more about that in a moment. And is that the difference, the injectables and the, more of the I don't know, like therapeutic, like not just this is, an ingredient that we're applying to your skin. It's actually like a procedure that we're doing. Is that the difference between, someone who you go see for a facial versus a
Yeah,
medical esthetician? Okay.
absolutely. Because then you have, like you said, like a day spa, and that's where you go and you want to give your skin a glow and you want to relax and have a nice girl's day. And
Hmm.
it's a calming and a relaxing experience. Maybe you have some stress in your life. That would be where you go to an esthetician that does a holistic relaxation facial,
Okay.
versus going to a plastic surgeon where you go with the idea that I want to fix XYZ, or
Hmm.
you go to a dermatologist because you have eczema or
Hmm.
psoriasis. So there's a difference for sure in the aesthetic world.
So let's dive in and talk a little bit about some of the things, anything that can go wrong does go wrong on your face during pregnancy.
Absolutely.
It's hormonal acne. Some people get like the brown spots. Can you talk a little bit about some of the things that happen and what people can do about them?
Absolutely. So the hyperpigmentation is what would be called brown spots. Sometimes
Mhm.
people refer to them H spots. Now, there's a difference between melasma, which is caused primarily by hormonal situations. So
Mhm.
that would be something a lot of people experience. You've heard of the pregnancy mask, Kelly, before.
Mhm. Yep.
So typically someone will get that on the forehead, across the forehead, or on the sides of the face. Melasma is more hormone induced.
Okay.
Then you may just get brown spots, right? Which are, kind of looks like, could be like the size of a dime or be as small as a pea. And those are, different. Those are more sun induced, right? From photo aging.
Mhm.
So it depends on what you have and what you treat. As a whole, when you're pregnant and you're breastfeeding, you want to stay away from retinoids, retinols. So those high vitamin A, you want to stay away from that. You also want to stay away from different types of acids. So an
Mhm.
acid that would be safe to treat your face would be lactic acid or glycolic or even mandelic acid.
Okay. So tell me about the retinoids even applying to the skin is a no during pregnancy.
Yes, that's a no during pregnancy and breastfeeding.
Oh, interesting. Because of course, all of these things are absorbed through the skin. So we're just concerned
Yeah.
about. Okay.
I mean, 20% of everything you do, right, is absorbed in your skin. 90% of your body is. So
Right.
when you put something on that's going to affect it gets systemic. And so you want to make sure that you're not doing anything that could go systemic and that could affect your pregnancy or your baby, even if you are breastfeeding, because obviously that milk is
Transfers. Right.
transfers, exactly. And then there's also a gel called different gel. A lot of people will treat with that pre-pregnancy when they get hormonal, and that's something you should probably stay away from as well.
Dang, we're losing all of the good stuff. I'm like,
Not
you've
everything,
literally
no.
just, if I were pregnant, you just stripped me of my whole skincare routine.
Well, you can still use glycolic, lactic, mandelic acids. And also, there are many things you can do with as far as acne goes, too.
Mhm.
And they're called phytoestrogen. So, phytoestrogens are things like yucca extract or things that will help
Mm.
balance you out. So, there's a lot out there holistically that you can do when you're pregnant. And there are some clinical as well as not, some people say, oh, do you have to go all organic? We don't really. There are some physician dispensed or medical grade products that I absolutely love. There's a product called Skinmedica. It's made by Allergan. Allergan makes Botox fillers and everything. And so that would be something that you could look into that product, and there could be still certain things you could use like vitamin C, vitamin E. So there
Mm.
are still like physician grade or medical grade, because let's say you've got X product on the shelf and it might have 2% vitamin C. If you get a medical grade, then you're going up to like the 4, 5 to 10%
Mhm.
vitamin C. So more effective for lightening, but still okay to use.
Okay. All right. Okay. That's really helpful. So the vitamin C, I've heard that before as well. The vitamin C is for kind of managing pigmentation.
Yes,
And then you
whitening.
mentioned a few things you could use for acne, and you would see someone in the medical aesthetics world for the clinical grade, or a dermatologist, or both, either?
Either. It depends on who offers.
Okay, amazing. So that's, I think, really helpful. I think people just kind of get into this like, this is just what happens. And I don't know if you have, you know, anecdotally what you see as far as like if people address these things while they're pregnant, right? I think some people kind of just go like, I don't need to be vain. I can just have, my face look be
Right.
a mess for 9 months. Do you have those things for longer postpartum if you haven't done anything while you're pregnant? I don't know if you have like a feel for that.
Yes, I feel like anything you let build up, of course, is going to be harder to reverse those, right? It's like anti-aging. People
Yeah.
will come in and say, I don't like this wrinkle on my forehead. Okay, well, you haven't started treating it at the age that you wanted to treat it. So now we have to actually go back and kind of baby step backwards to treat that. It's going to take longer to correct a problem. So if you're proactive and you start correcting it during pregnancy, makes it a lot easier for you to maintain that hyperpigmentation, that acne condition after you've already had the child in your postpartum.
Okay. And so this is something that I I have heard this anecdotally many times, and I've like told clients, "Hey, I don't know if this is factually true, but I've definitely heard this," which is that going through birth and postpartum is often for a lot of people like going through puberty again. So people may come out the other side feeling like this is not the skin like this is not what my skin was like at all before having kids. Is that
Yes.
something that you see? Can people do anything about that?
Yes, again, it's all about maintenance and balance. It's kind of like if you think of it, it's not a doomsday thing because let's think about this. If you had stress in your life, you might have a stress breakout, right?
Mm.
Does it mean it's never going to go away? No, you can definitely manage it. It's how well do you manage that and how well do you maintain it?
So it's possible someone could kind of go back to like their normal again, even if
Yes,
things are crazy postpartum.
exactly.
Cool.
Yes. You just have to have a good regimen and a good plan of action.
Yeah. And that, I mean, it seems like one of those things. I've spent a lot of time after my daughter being like, I'm just going to wait it out. I'm going to wait it out. Okay, it's not going
Yeah.
away.
And then it doesn't go away, and you're like, maybe it's not going away, and I need to do something about
Yeah,
it.
yeah, 100%. I'm like, I wish I had done something sooner. Um, but live and learn. Uh,
Ex-
so let's talk a little bit about injectables, because that is one thing that the two complaints I hear people say is like, my children did this to my abdomen, and
yeah.
also I have wrinkles that like I've never had in my life before. And maybe that's hormones, maybe that's sleep deprivation, maybe it's just aging. Which, I always remind people, I'm like, you're also, if they're 2 years postpartum, I'm like, you're almost 3 years older than what you're comparing yourself to. So like maybe your baby's responsible, but maybe not exclusively. What are some, you know, if someone's just starting to think like, okay, like crow's feet, maybe laugh lines, like where do they start? What might they be interested in?
So if it's someone that's pregnant or postpartum, you're going to be careful with injectables, of course.
Longer postpartum. So like not
Okay,
breastfeeding a year or more, that kind of thing.
absolutely. So there's great eye creams out there that have growth factors. Growth factors have peptides, and peptides are the makeup of your skin, and that's what keeps your skin tight and firm and helps with your collagen. So anything with growth factors in it, even eye creams that are specifically, supplied with growth factors are very, very good for the under eye area. It's a very delicate skin area.
Mhm.
So you choose wisely, but that's very possible. If you want to go to the next level, then you're thinking about Botox. Botox is an injectable made by Allergan, and there are other injectables out there. There's Xeomin, which is basically like Botox without the protein in it. Some people prefer that, and it's just a preference matter. Botox has been around for years. It's made by Allergan Aesthetics, and that basically relaxes and causes the muscles to atrophy. And then over time, so we always say that your second Botox is your best Botox, because on your first Botox, you're kind of, again, trying to go back in time and repair, right? So you may relax some of that, but not 100%, right? Just a little bit. You're going to soften those lines. So if you want a softening, and a good injector, a physician assistant that I work side by side with right now, a good injector will know exactly where to go and how much you need and be very conservative. because most of us, let's face it, we just want to look like a great version of ourselves. We don't want people to come up to us and go, wow, you look so
Where
tired.
where do you get your injectables done? That's like the other end that we don't want, right?
No, you don't want to be drooling on yourself. That's when we have to just cut you off and be like, you know what? No, it's too much, right?
Yeah.
So you can soften the lines on your forehead, your glabella, which is between your eyebrows, around your eyes, and even a lip flip. A lot of people will end up their straw drinkers, so they'll get lines above their lips. So you can do a couple units above your lip and soften that line to give it just a millimeter rise, because as we age, as everything else, gravity takes everything down with it. So those are options. Fillers are also an option in the cheek area. Usually
that's what I was going to ask about. So that's something that I just recently learned, that like Botox and fillers are different. Can you explain that to us?
Absolutely. So Botox is going to relax an area. Filler is going to fill with hyaluronic acid. Most injectables are made out of hyaluronic acid. They're hydrophilic. That means they draw water to the area to give you volume. So of course, again, a very advanced injector would be choice. And typically they'll start injecting mid-face, because a lot of people will come in and they'll want to do the lines around their nose, which is called the nasal labial, but they don't realize that if they just got a little volume in their cheeks, that would rise that area, taking the heat off of that nasal labial area. So sometimes that's all you need. Or maybe you just need a little filler in your chin to help your side profile, so you're not looking so chinny underneath the chin there, because people don't like that swallow they have. So again, it takes somebody who knows the anatomy of the face to look at that and be able to tell you conservatively what and how much filler you would need. And there are different types of fillers for different parts of your face, because the molecules are different. So
okay,
that's something to consider too. Some people will say, well, why is this filler more expensive? Well, because it's a longer lasting one, or it's a different size molecule. So that's another consideration.
Now I have barking dog. I don't know if you can hear that. Sorry. He is actually outside, just right outside my window. So what I'm hearing is like, definitely just go look on Groupon and do what's cheapest, right? Like, experience doesn't matter.
A unit, grab it.
This is something that I see often, right? So like,
just kidding on that, by the way.
Filler parties or Botox parties are like a thing, or people will run like a promo or something, and it's like blah, blah, blah units for this much money. If someone's like, look, I don't want to waste anyone's time, I want to know like roughly like, where am I starting at? Is there like, it's safe to say if it's your first go, you're not going to do more than X units or something?
Well, the actual companies have recommendations. So for instance, for a full face, that Allergan recommends about 60 units, okay, around 60 units. So, some people come in and say, oh, I had 10 units and look, my Botox is gone. It's gone. My wrinkles are back. Well, that's because you didn't get enough per area, or you just didn't get enough, or maybe you've had too much. And that's the reason that we were talking about for that sharp looking face that we all kind of want to stay away from and look more natural. So it just depends. But Allergan and the companies that make the different fillers, like Restylane and Juvederm, they all have indications of how much and where they should be used. So if you stay within those parameters and your provider is experienced, then typically you're in the good with that.
Amazing. Okay, that's really helpful. So you mentioned, fillers, what you might be looking at doing for wrinkles and things like that would be different if you are currently pregnant or postpartum breastfeeding. Is it just a no-go on all of those things?
So that would be a research thing for filler. For Botox, that would be indication would be to wait on the Botox typically.
And then this is something that I've always wondered. I think I've heard people like kind of say this colloquially, or like, I don't want to start using anti-aging products, or I don't want to start using fillers because then I'm going to need them more and sooner. Is that true? Is that a thing?
So what happens is as you get muscle relaxing rates and in any area of your face, body, then of course, if you didn't use it again, then once it goes out of your system, you metabolize that. It's just like with any other drug, then you're going to notice. So you'll see those fine lines, right, eventually. So it's not going to make them any worse. It's going to take it away. So then when
it's going to make you sensitive to,
you are going to be more sensitive to seeing those because you've had them go away. As far as filler goes, eventually when you're injecting hyaluronic acid or you're using products, there's a product out there called HA5. It's a has 5 different hyaluronic acids, physician dispensed by Skin Medica, and different products like that. There's plenty of good products out there that have hyaluronic acid. And eventually, when you're using those, your skin will actually start producing its own hyaluronic acid on its own.
Oh,
And a lot of those products that are injectable products, and again, I'm not endorsing any which one, it's just a fact that your skin will eventually say, hey, maybe I should start producing that. It's like collagen. If you get microneedling, your skin will automatically go into overdrive thinking, I need to heal this area. And so it will produce more collagen. So eventually, if you're doing these proactive things, then it will help you in the long run to stay on top of it. And if you say, you know what, nope, I didn't like the way those fillers or the Botox look, or this product, I don't like the way this product, you stop using it, it goes out of your system.
it's not going to get worse. And then what about, can you talk a little bit about some of those procedures like microneedling, like peels, those kinds of things?
Yes, absolutely. So with peels, that's going to be something that's a chemical typically, right? A mixture of chemicals. There's many different peels. There's also natural peels. So like we were talking about with pregnancy, if you want to do a lactic acid peel, okay? So there are things that are also safe, again, for when you're pregnant that will help dissolve that surface dead skin so that your skin can breathe again, and therefore helping it to not break out as much, as well as dermaplaning. That's something you can get done all day long when you're pregnant. A lot of people will have vellus hair, which is AKA peach fuzz, and they'll have it on the sides of their face or on their neck or behind their ears. Well, if you have a medical esthetician or a provider or physician assistant to remove that, it's done with a surgical scalpel, and it goes underneath the hair and removes the dead skin and the hair with it. So then you have less breakouts. Now you've got this hair that's not trapping in the dead skin and the oils. And so then you'll see less breakouts. You also see your products being more effective because they can actually get into the skin because that vellus hair is not laying on the surface. So that's another very safe thing that you can have. Microneedling, as far as that goes, that is creating a controlled abrasion on the skin. You can go anywhere from 2 millimeters down, which would be like the Skin Pen. It's an FDA approved device, or you can go something like we have a device that goes down to 4 millimeters. So it depends on the depth of how much you want to go. Do you have facial scarring that you're working on, or are you just trying to induce collagen? So there's different types of microneedling, and there's also combinations of microneedling with radio frequency.
Oh, I've never heard of that.
So that radio frequency is done for collagen, for lifting and firming the skin. And the microneedling is for the texture and the production.
Very interesting. So what I'm hearing is there's lots of options still available. Would you say any of those are like a little bit more like that seems, at least to me, a little bit more like beginner friendly than going with injectables? Is that generally what you see? People kind of start with those things?
Yes, absolutely. And so typically what you can do too, you can think of it as a workout, right? So if you work out and you just join the gym, you're not going to go there for 2 hours. Well, typically you're not going to go there for 2 hours and like, I'm going to do every machine on the highest weight. Right. It's the same with your skincare routine. And also the same as with switching it up. So you might do one muscle group and you can't even sit on the toilet the next day because you use this certain machine at the gym. And then you do it all the time for a year and you're like, wait, this isn't working. My muscles aren't sore anymore. It's the same thing with your skin. You need to switch up your regimen. Same thing with your hair products, because eventually your skin is like, hey, we already had this peel done 3 times. So now let's switch it up. And also you can do microdermabrasion, which is you can do it's a diamond tip. It has little encrusted diamonds, and that's a surface dead skin removal. And it'll suction it into a little tube, and then you can put different serums in. They call it typically the hydrofacial or the hydroglow. So there are things, that's the surface. That's where you want to scratch the surface. You start with microderm, then you baby step to a light peel, maybe an enzymatic peel that has the lactic acids, or holistic peel, a pumpkin peel, something that's natural. And then you can go from there maybe to microneedling. Then you would do the radio frequency. So you can kind of baby step up and then switch it back and forth, depending on what you're looking for. Is it texture? Is it dark spots? What are you going for? What do you need?
I love this, Aimee. You know, you're speaking my language, because I totally, I'm like, yes, this so happens in which, your face is just muscles, like, well,
yes,
muscles and skin and
muscle,
fat
skin,
and all of that.
exactly.
But
Collagen.
often, people will say like, oh, this workout doesn't work anymore. And I'm like, well, have you done the same thing 5 days a week for a year? Then yeah, no, I'm not doing anything anymore. Because you've gotten the benefit that you can get from that thing. So I love that. I think that often I don't know if this is just my perception, but I think it could very easily be perceived as like, oh, well, this doesn't work because I keep having to do the, getting the same thing and it's not giving me the same result anymore. And it's like, it's actually desirable that we do different things. We're not looking for, you know, oh, I'm just going to set an appointment to do this thing every 6 months for the rest of forever. We actually want to do
Right.
different things.
Right. And different times your body calls for different things, right?
Mm-hmm.
So sometimes you may not have that, you can maybe get those dark spots under control.
Mm-hmm.
Once you're not pregnant, you're not lactating, you're not breastfeeding, you can use retinols. Retinols will help with that surface skin exfoliation as well as lighten those dark spots. So there are different things, like you said, that different times in your life call for different measures. The same thing with diet and eating, right?
Mm-hmm.
So at different times, your body may need more protein, more
Mm-hmm.
iron. Same thing with your skin, same thing with your face. You may need different vitamins. Another important thing is your rest. If you have breakouts, you need at least 10 minutes a day of light or sunshine for your cortisol levels, or you're not going to be sleeping right and properly. If you're not getting the proper sleep, guess what? Your skin does not like that. You're not drinking
Nope.
plenty of water.
Your muscles don't like it either. Nothing functions properly if you're not getting sunlight and you're not sleeping.
Exactly. So that's very important to remember that, fluctuating hormone levels do play a role, of course, in breaking out and how your skin looks. And of course, fluctuating hormones does equal a lot of time lack of sleep or lack
I
of
was going to say also affects your sleep. So do you have acne from not sleeping or do you have acne from hormones? Who's to say?
Exactly. You have to figure that out, and it's process of elimination.
Sure. Yeah. And I mean, of course, like this is often I tell people this with pregnancy. I'm like, so the bad news is we're not trying to change those hormones. Like
right.
There's only so much we can do with that. Like, of course, we can treat the symptoms, but
deal with it.
Yes, 99% of the time, I'm like, let's get to the underlying root cause and address that. If it's pregnancy hormones, we're not trying to address the root cause. Like, you're going to have a baby and then it's going to be dealt with, but we can totally treat the symptoms along the way.
Exactly. Yep.
Would you, I can give you the mic to make a sun care PSA. Is there anything you would like us, being Floridians, anything you want to tell us about sunblock, sun care?
Yes. So preferably mineral sunscreen is better, just overall for you, your health, and the skin. So if you can find a good mineral sunscreen, and they come in many different lightweight forms. So even if you are a person that's prone to breakout, it's not like back in the day where they're thick and greasy, and they smell funky. You can get powder form. There's organic brands out there that make the powder SPF 50. And really, even if you talk to your dermatologist, if you hit that 30 mark with the sunscreen, you're doing good. So you're going to reapply anyway, whether it's a 30, 50, so if you're in the 30, 50 range, you're good with that. Just reapplication.
Amazing. And my most recent dermatologist visit, they were like, hit the neck, please hit the neck.
Yeah.
I did get a glowing stamp of approval from my last dermatology visit. It was, I wasn't sure how to take it because it was, oh, you grew up here? Oh, your skin looks great for someone who grew up in Florida. I'm like, backhanded compliment.
You're like, is that good or bad?
Yeah. Like for someone who grew up in Florida, great, awesome. They're like, you're 42, right? I'm like, me. not a compliment anymore.
Right.
But that was their I'm like, yeah, I put on SPF 50 every day, and they're like, do you put it on your neck? And I'm like, no, because it's makeup.
Yes. So then you're like, maybe I should. You can always apply it topically on top of your, a lot of people do the powder sunscreen on top of their foundation. And
I've never even heard of powder sunscreen. Do you have a product recommendation?
Yes, we have one that we carry at the med spa that I work at. It's by Eminence Organics, and I love it. It's called Sun Mineral Defense, and it comes in probably 7 different shades, translucent. I think our biggest seller is called Cherries and Berries. That seems to work very well with someone who has a little bit of color, but not too much. That's
amazing.
An excellent.
We'll put that in the show notes for sure.
And it's buildable coverage. So I like. Mm-hmm.
Okay, cool. So before we wrap, is there anything else that I forgot to ask you that you're like, oh my gosh, all the pregnant and the postpartum people, they need to know?
Yes, just quick blurb on stretch marks. Make sure that you're using a body oil mixed with like a firming body lotion so that you can have more flexibility and expansion. So as your skin is expanding, your belly's expanding, just for the comfort, you want to make sure that you're hydrating those marks, those stretch marks, because it can be incredibly itchy or tight all around and
Mm-hmm.
uncomfortable. So you want to make sure that you're mixing a nice oil like an apricot or a jojoba
Mm-hmm.
body oil with like a firming and organic firming lotion. And that way you're getting the best of both worlds. You're hydrating that area, and then you're less likely to see those stretch marks not return back to where they were, because a lot of times they will fade within 6 months. So I just wanted to mention that if you're worried about stretch marks, make sure that you're doing a body oil, and you can also add a capsule of body oil. Let's say you're just too tired. I mean, because pregnancy, let's
Yeah.
face
Put
it,
it in the lotion.
you're making a baby, it's exhausting. Put it in the lotion, or just throw a capsule in your bath, because baths are relaxing anyway. And at least you've got that oil on the surface, and then you can kind of just pat it dry. So that's kind
So
of another quick tip.
give me the dumb question. What is firming body lotion?
A firming body lotion just has ingredients in it that will help the skin to be more toned. So
Okay.
you can look for any of those. And I always kind of, with that, again, when you're pregnant, I always look for something that's more on the holistic or natural line with that.
Okay. Amazing. So you were saying that if you kind of, even if you see them come during pregnancy, they
Yes.
may still fade if you're kind of taking care of it. Are there other things you can do postpartum?
Yes, continue to use that even 6 months after. That's a big thing, because a lot of people will quit using a product after, or quit putting oils on their skin. You want to continue doing that, because it will subside typically after 6 months of that, because your skin is still expanding and stretching. So you want to make sure you continue on that body and skincare regimen after your pregnancy.
Amazing. Is
Yeah.
that any different with different pigmentation of skin, darker pigment versus lighter pigment?
Yes, and it's also hereditary as well.
Oh,
So depending on how good the genetics as far as the gene pool in the skin goes, some people are very prone to stretch marks, some people are not prone to them at all. So that is definitely a thing, but it doesn't mean that it's without fixing. So you
okay.
can definitely fix some of those things as well.
Would something like a vitamin C, like, are there like actual products for fading stretch marks
Yeah,
specifically?
there are. Yep.
Cool. So any of those things would work too.
Yes, absolutely.
Awesome.
And I would make sure you have something with a high quality ingredient as well. Make sure that you're looking at something that's got a higher percentage. Like if you are looking for something that is oil, make sure that it's pure, that it's not just something got any chemicals or additives in it.
I'm obsessed with pure jojoba oil. It's like the only thing I will use to moisturize.
I prefer that. If you're going to use an oil on the skin, it's definitely very nice.
Yeah. Anything else that I forgot to ask you?
Only one thing I was thinking, this is just off topic, because we were talking about pelvic floor, and that's what you do. You talk a lot about pelvic floor. We just got in this equipment this week called Votiva, and it's for vaginal rejuvenation.
I know about this. There's a med spa near us that does this.
Yes. So it's radio frequency for the vag, for tightening, for people. I have heard amazing, amazing things about this. And we are actually training on Monday on this device. And we cannot wait, because not only does it, because I know personally, like many people that I've spoken with have had it been cut or they've torn down there. Yes.
Don't even get me started on episiotomies.
Yes. So I did not know until someone I knew chose to have an episiotomy, and and it's just, it's a hard decision at the time. Of course, when you're having a child, everything is a hard decision. So you're trying to make the right one.
Yeah.
So we are super excited about getting Votiva in, because we have actually, seen before and afters. We've actually had patients come in and they're like, "What, you're getting the Votiva? I had that done 3 years ago. It changed my life as far as sex drive, as far as tightening, as far as dryness," because some people are so dry that they're irritated. They have to go to medications because they're so dry after having a child, because their hormones are so off. As far as people, they'll say, "Oh, I have dripping." Like I feel like I'm 80 years old and I'm 40, and I've had a. Yeah. I mean, all of the above. It is supposed to be fantastic.
So that's a similar. You said that's the radio frequency. So that's similar to the facial treatment that's like designed to create collagen.
Yes, the same company makes it. And really, if you think about it, again, you're talking about tissue, right? Yep. Vaginal tissue, facial tissue, it's tissue. And so this is helping heal that tissue so that it can be healthy tissue and function. Therefore, an issue that we all face. And, of course, these are things we don't want to talk about as moms, as wives, as women. It's, we're all embarrassed to talk about these things, but they highly affect our lives on a daily basis.
100%.
Whether it's like we said, you've had a child, whether it's vaginally, even if you haven't had a child vaginally and it's a C-section, we still have issues that are hormonal that cause different situations, right? So we're really excited about it because it's another thing we've added to our health and wellness feature at our medical spa. And so we think that it's really going to help change a lot of people's lives.
I think it's a really valuable addition to this kind of like suite of options that people have, right? My just like people ask me all the time, they're like, what else? Like, I'm going to do my core exercises, but like, what else can I do to get better results? And I very much see this in the same place of like, I would love if everybody could just regain pelvic floor strength from doing their exercises really religiously. But like, I have had
Right.
people for whom it doesn't either. I mean, of course, they may actually need to see a pelvic floor PT. There may be some kind of dysfunction going on there, or
Mhm.
they may just not be getting, particularly like, of course, we know it's harder to build muscle the older we get. So,
Yeah,
like, do it soon. Everyone who's listening, do it soon. Um, but, at some point, it's like, if there's other tools available, let's use them.
exactly. Yes, absolutely. We're super excited. And the physician assistant I work at, she did rounds and she did years of OB as well as
Mm,
injectable training. And
cool.
so she had already had experience with this by working. She's from Las Vegas and she had worked and they actually had something that they called it prettier kitty because there was a lot of people that had some situations that were not desirable. And so she's when they came out with this, she was like, "Oh my goodness, this is going to be so great." And it's been out for quite a few years.
Hmm.
It's just new to us and how it's been being used, and also technology and different ways, just like with facial treatments, are all
Yeah,
expanding
right.
and getting better and better every day. So there are more options out there, and it doesn't have to be embarrassing to talk about it because it is a fact of life. It's like raising children. We come across these things in our life that are uncomfortable maybe to talk about,
Hmm.
but we feel like if more women know that that's available to them and it's not an embarrassing situation because
Right.
really it's like any other problem that we have in life, right? It comes up. So
Yeah.
things happen and there are things that we can do to help make our life more enjoyable.
Yeah, absolutely. It's for me, I'm like, if your arms were so weak that you couldn't pick up your child, you would be like, let me go see a trainer and get stronger arms. And yet, like, if our pelvic floor is so weak we can't hold in urine or have any sexual pleasure, we're like, I don't know, I guess nothing I can do about that. It's like, come on,
Exactly.
like, I don't know. When it comes to vaginas, all logic exits the building for some of us. So I'm excited
Exactly.
more people are talking about it. I saw this. I a practice near us rolled out this treatment, and I was very very curious. And then the world shut down, and I wanted to like connect with them and see what kind of
Yeah.
results they're getting and all of that. But I'm excited that you're
Hmm.
doing that. Can you tell people where they can reach you? You're in Daytona, Florida, which means you are somewhat local to us. If people are in your area, where can
Hmm.
they actually work with you and how can people find you online as well?
Yes. So I do have an Instagram right now. It's my last name, which is Bowen, Bowen, and Beauty. So it's Bowen Beauty One. That's my Instagram under my name, Aimee Bowen. And my name, Aimee, is spelled like Aim toothpaste. It's Aimee, two E's on the end. And Bowen is my last name. And then on Facebook, I'm just Aimee Bowen. And the medical facility that I work at, we have a physician assistant and a medical director there now who does weight loss and wellness.
Mm,
And so she, like I said, is from Las Vegas, and Dr. DeCarly is our medical director. He's a gastroenterologist, and we have a practice there. It's their practice. I work with them, and it's called Evolve,
mhm.
and it's called Evolve MD Modern Med Spa. And we do have a website, evolvemdmodernmedspa.com. And we will be adding the Votiva, which is what we just talked about, which is the new radio frequency treatment. And most of our treatments are listed on there. And we
Amazing.
do consults. So if someone wanted to come in for a facial, skincare, wellness consult, IV vitamin therapy, or the vaginal rejuvenation, they could certainly do a consult complimentary with us. And we give a skin plan or a wellness plan. So they actually leave with a list, short-term, long-term goals, and what is this going to cost me and how can I budget for this?
Amazing. I love it. I wish more people did that. It really is. It's so overwhelming. And it's like, I guess I'm just gonna call a person and like book for them to scrape my face off. Like
Right.
it's
And you
it's
don't
kind
know
of
where to go.
freaky. Yeah.
Exactly. So it's if you take the baby steps and it's not so overwhelming. It's like, okay, here's where you're going to start. You're going to start with a cleanser and a moisturizer. Let's just do that for a month. And then see me back, for XYZ. And you print it out and you have all the pricing there. And that way everybody can put it in their time frame because it might just not be money. It might be time frame. If you
Mhm.
have kids and you're
Oh
busy or
yeah, this is one of the number one reasons that I see people like not do something like pelvic floor physical therapy. They're like, that's an
Mhm.
office
I
I
don't have
have to
time.
go to where my kid is not welcome.
Right. Right. So it's just one more thing you have to add to schedule in. So
Yeah.
we try to make it very easy, but yes, and you can always message me through Facebook or message me on Instagram on my private one or on the Evolve MD Modern Med Spa. And happy to reach out to anybody and answer any questions as well.
Amazing, Aimee. This has been really, really helpful. I think people are going to walk away. I'm like excited to have a resource where like when people say like blah, blah, blah is happening to my face, I'll be like, great, go talk to
There
Aimee
you
because I
go.
don't know anything about that. I'm like, tell me again about Botox versus fillers.
Exactly. That's okay. You can call me.
Amazing. Thank you so, so much for your time.
Absolutely. Pleasure talking with you, Kelly. Have a great evening.